video is for any woman who is currently having a recurrent miscarriage in the first trimester, especially when it's between 5 weeks to 8 weeks of gestation. There are some women who has been experiencing a recurrent miscarriage between 5 weeks to 8 weeks. Once the pregnancy reaches 5 weeks or 8 weeks, they're going to lose the pregnancy. If you're that woman, or you know of any woman who is currently having a repeated pregnancy loss in their first trimester, then you need to send this video to them, or you may need to watch it if you're the one, because what I'll be discussing in this episode may be the reason why you're not carrying your pregnancy beyond 8 weeks. If it's something you're interested in, then stay with me till the end of this video. I said in the previous episode that a man can be a cause of miscarriage too. Absolutely. We are going to learn how a man can be a cause of repeated miscarriage in the first trimester. A man can also be a cause of a failed IVF and a failed IUI due to poor sperm quality, and what to do if you're experiencing a persistent failed IVF or you've been experiencing a repeated pregnancy loss in the first trimester. We all know that for a pregnancy to progress beautifully, a healthy sperm is needed from a man and a healthy egg is needed from a woman. If a sperm with a poor quality fertilizes a healthy egg in a woman's body, it can affect the outcome of that pregnancy. I mean, the pregnancy may not progress, or it may not even form in the first place. And in case where a sperm with poor quality is being used to fertilize a healthy egg outside the woman's body in case of IVF, it can also affect the outcome of that procedure. When there is infertility, that is when a woman and a man are unable to get pregnant and a man is being asked to come for investigations, there is one popular test that is usually requested from a man, which is semen analysis, seminal fluid analysis, SFA. And what does a fertility expert or a doctor wants to know about seminal fluid analysis? It's the motility. We want to check the percentage of the sperm that swims really well, if it's enough for a conception. We want to check the morphology. We want to check the amount of sperm that has good shape to improve the chance of conception. We also check the overall count of the sperm in case of azoospermia and oligospermia, that is low sperm count and no sperm cells at all. We check for volume and also pus cells in case of infection. But there is an important parameter that is usually not checked, especially when a woman is experiencing a repeated miscarriage during the same time in every pregnancy. What is that parameter? That parameter is sperm DNA. Yes, sperm DNA. What is a sperm DNA? A sperm DNA is a genetic material that is inside a sperm cell that contains instructions needed to create a baby and to develop that baby. I'm going to make it easy to understand. This is a sperm cell, and inside this sperm cell, there is a genetic material inside. This genetic material contains instructions that are needed to create a baby and to develop the baby. That means that this single sperm cell that is fertilizing an egg in a woman's body determines the development of that baby, it determines the traits of that baby, and it determines the health of that baby. I believe now that you understand at least a bit the importance of a sperm DNA during a baby formation. What happens when there is problem with a sperm DNA? There are 3 major problems that usually happen when the sperm DNA is damaged. You know that we said a sperm DNA has a genetic material that is needed to create a baby. Don't forget, and to develop the baby. Imagine if that material that is needed to create a baby is being damaged. What happens? The baby will not be created, and that is infertility. The embryo may not develop. The embryo may not develop properly. When the sperm and the egg meet, they come together, that baby may not form because a genetic material that is needed for that baby to properly develop during the conception is missing. That is when there is problem with the sperm DNA, so that baby may not form and a woman may not be able to get pregnant. That is infertility. So a woman may be releasing healthy egg, fallopian tubes are open, hormones are balanced, uterus or the womb is okay, but yet there is no pregnancy. That is because that sperm that is coming from a man, that sperm that is fertilizing that healthy egg in a woman's body has problem. The genetic formation is being damaged, or the quality of the sperm is not good. The second major problem that can happen is the baby may not implant to the womb properly. The baby may not attach or stick to the womb properly because the certain genetic materials that are needed to help that baby to gum, to stick to the womb where it's meant to be till the end of the pregnancy are missing or fragmented, and that is a poor implantation. A poor implantation may result to an early miscarriage. If the baby failed to attach to the womb, what will happen? It's going to come down and the woman will start bleeding, and that is a miscarriage. And the third major problem that can arise from a sperm with a poor DNA or a sperm with a poor quality is that if that baby was formed during conception and it's attached to the womb, that baby may fail to grow. At certain weeks, the baby can stop growing. That is when you see women losing pregnancy from 5 weeks, some 6 weeks, some 7 weeks, 8 weeks. It will come down because the pregnancy cannot progress beyond 7 to 8 weeks, because the certain genetic materials that are needed to make that baby to grow beyond that stage are not there. Hence why a woman can be having a recurrent miscarriage between 5 to 7 weeks or even 8 weeks at most. I also believe now that you now understand how a poor sperm quality can be a cause of miscarriage or be a cause of delay when a couple are trying to conceive. Now let's talk about what are the things that damage sperm DNA. What are the things that reduce the quality of a man's sperm? Number one is smoking, excessive alcohol, and recreational drugs. This is not the first time you've been told to stop smoking. You've been told countless times to stop drinking excessively, and you've been told several times to stop using illegal drugs or illicit drugs, because these factors, all these things that I mentioned, excessive alcohol drinking, drugs, and alcohol, damage sperm DNA. They don't only damage your sperm DNA, they also reduce the quality of your sperm. They also cause low sperm count. They cause low sperm count, they damage or reduce the quality of your sperm. This is why you're meeting with your woman and there is no pregnancy. Yes, you're releasing sperms, but the quality of the sperm is not strong enough to fertilize that egg in that woman's body. The second problem is excessive heat exposure. This is not the first time we are hearing that. Wearing tight boxers, going for hot baths, that is sauna, or placing your laptop on your laps damages your sperm quality. In fact, it also causes low sperm count because your sperm cells are so sensitive that excessive heat around your testicles can damage them. It can damage them or reduce the quality of your sperm. And also, it does not protect your sperm DNA as well. It kills or it destroys your sperm DNA. So avoid excessive heat exposure. Number 3 is age, and that is natural. It is not only a woman's egg quality or even the numbers that reduces with age. A man's sperm quality reduces with age too. Number 4 is chronic stress. You see, there is nothing about stress that is healthy. Be financial stress, emotional stress, physical stress, relationship stress, whatsoever, or any type of stress that it is, there is nothing about it that is healthy. So you need to find a balance between work and sleep. Really, you need to start learning how to take a break from stress. So a lot of hormones needed in your body to produce or to protect some certain cells in your body will be able to do their job. Number 5 is poor nutrition. Eat well for the sake of God. Eat well. Invest your money on good food. Eat foods that are rich in zinc, selenium, vitamin E, vitamin C, and even folate. Because when you're stressed, These are the nutrients that protect your sperm cells from damaging easily. Number 6 on my list is infection, chronic infection, which is a topic I'll be discussing in another video. The last one on my list is medical conditions like varicocele or even diabetes. All these problems can affect the quality of your sperm. So if you're battling with diabetes, varicocele, high blood pressure, cancer, you may need to get treated so your sperm DNA can be improved even if you're opting for IVF. And the last question is, what should be done if a woman is experiencing a repeated pregnancy loss between 5 weeks to 7 weeks or between 5 weeks to 8 weeks? This is time for you to take your partner to a hospital or to a lab so that they can do 2 certain tests. One is seminal fluid analysis, that is SFA, and the second test is DNA fragmentation test. DNA fragmentation test. They'll be able to know about the motility, the morphology, and the overall count of the sperm, and also they will be able to know about the DNA of the sperm. If the DNA of the sperm is higher or is lower than what it ought to be, a fertility physician will be able to put you on adequate supplements and things to avoid in case you are experiencing a repeated miscarriage. So you'll be able to carry your pregnancy beyond 7 weeks or 8 weeks till delivery. If you found this video helpful, kindly subscribe to my channel, like, share, and drop your comment if you have any. My name is Dr.Shakeerah. I am a licensed practicing medical doctor and a fertility physician at Abin's Fertility and Andrology. I'll see you guys in the next one.